Hi, I'm Michael Marin. At Holy Name Medical Center, we believe that all citizens need to be informed about the important healthcare issues that affect their daily lives. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community. Horizon Blue Cross Blue Shield of New Jersey. Bloomfield College, offering small classes and big opportunities since 1868. Wells Fargo. PSE&G, committed to improving New Jersey's economy and strengthening its communities. Holy Name Medical Center in Teaneck, New Jersey. Healing begins here. And by Johnson & Johnson.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Hi, I'm Steve Adubato. We are in East Orange, New Jersey. This is the Newark Community Health Centers. Behind me, you're seeing some folks. This is the tail end of a really wonderful day. Folks are here for the second enrollment period for the, they call it Obamacare, but you know it's the Affordable Care. It's the second enrollment period that ends on February the 15th, 2015. We're here. We've had a terrific panel discussion. For the next half hour, you're going to listen to some of the experts we spoke to, some of the people who came here to sign up for the Affordable Care Act. This is an event that was funded by the Healthcare Foundation of New Jersey. It's a great event. So many people here. It's chilly. It's November. It's late November in New Jersey, right before Thanksgiving. But I'll tell you what, it's a hearty group of people who came here to sign up. Dozens of people signed up for the Affordable Care Act to get health insurance. Nothing could be more important. So listen to the folks we talked to, the experts, the people who signed up, find out why it's so important. It's a half hour of public broadcasting that's so important because what is more important than getting yourself covered? Check it out. We're here with Ada Rivera, who is health coverage organizer with New Jersey Citizen Action, who is one of the many organizers here today at this very important event. Ada, this is part of the second enrollment period for this very important effort to enroll people in the Affordable Care Act. Ada, what makes this enrollment period different than the first one, which was challenging but successful?
I think what makes this enrollment period even more important is we will have even more challenges. There are still those hard-to-reach people that are still unaware. As surprising as it may sound, the lack of awareness is still huge, especially within underserved communities. And also the details about the ACA are still unclear to many folks.
But the other thing is this. I also want to be clear, and Ada will help us understand this, that people who were enrolled the first time also have an opportunity to shop the exchange and find out if they can get better premium rates?
Absolutely. They will have now different plans. There are more options. We have more carriers that have joined.
More carriers. Why is that?
Well, because now that, health insurance companies are seeing how great it did last year, we had a huge amount of folks that were able to enroll, not just in New Jersey, but nationwide. Now they're catching on and saying, hey, I think this may be a good, bid for us. We need to be part of this healthcare. Everyone is interested. So now we have, more coverage and more plans for folks to be able to choose from.
One of the barriers that is being talked about, one of the obstacles, has to do with language. The Spanish-speaking issue is very clear. Those who are not engaged with English being the primary language. Talk about that first in English, and I'm going to ask you very simply to translate and speak in Spanish to those who use Spanish as the primary language. Why is that continuing to be a problem?
That is continuing to be a problem because in those areas, we still need to do aggressive outreach. We still need to do awareness. You have to remember that with Latinos, especially within underserved communities, not just Latinos, but all, that is not the top priority healthcare. It should be, but it isn't.
It's not. Now we're talking places geographically, Newark, Irvington, East Orange, Camden, Jersey City, Atlantic City, right?
Yes. Those Atlantic City, perfect example. Have all those folks that lost all their jobs, casino workers. That's top priority for them. not healthcare. We have to be there to educate them, to let them know you can have free healthcare, you can qualify for tax subsidies. There are options for you to help you, to relieve you from what your stresses are of affordability.
Okay, can I ask you to, in Spanish, speak directly to those who may be saying, I missed the first period, I wasn't that focused, or frankly, for whatever reason, not even intentionally, but just were not as engaged, in Spanish?
Okay. Para que sepan todos los latinos que la cobertura estás ahí para usted. Tiene que inscribirse. De ahora adelante, noviembre 15 hasta febrero 15, tienes que inscribirte. Es tan importante que sepan que hay seguro para usted y seguro gratis, seguro que te pueden ayudar, seguro que te puede ayudar con el dinero. Yo sé que el tiempo está difícil, que la gente no tiene suficiente dinero, que la lucha sigue, pero tienen que inscribirse.
Now, I understand Italian to some extent, and I'm going to extrapolate, and you help me if I'm wrong. You were saying that this enrollment period goes from November 15th to?
Febrero 15, February 15th.
And you said it does not cost any money.
It doesn't, and it doesn't.
It's not difficult.
It's not difficult, and there is assistance out there. If you don't know how to get on the email, if you don't know how to get on a website, you can get free in-person assistance. You can go to covernj.org. You can find a location near you where you would have an enrollment specialist who is certified and can help you get insurance information.
Dozens of people have enrolled today for the second enrollment period, and also the Greater Newark Healthcare Coalition is represented. But for those who do not know what Citizen Action is, your organization, and why you're so involved, tell me what you are doing and why this second period is so important for you and your organization.
It's important for us because we know that healthcare should be a top priority for everyone. We want to be able to provide that awareness and that education to folks. We are a advocacy organization, one of the largest in New Jersey. So we want to be able to help everyday citizens that, have issues and struggles and concerns with day-to-day issues. And healthcare is top priority for us.
We're here with Dr. Pamela Clark, who is the President and Chief Executive Officer of Newark Community Health Centers right behind us. People are being enrolled. They're getting health insurance in the second enrollment period of the ACA, the Affordable Care Act. Talk about why this second enrollment period is so important, Dr. Clark.
This is very important, and thank you for being here, Steve. The most important thing is that the enrollment is going very smoothly this year, and a lot of people didn't know that the enrollment period exists. So the most important thing this year is to make sure that we inform many people in the community to come and get enrolled and get insurance. Very important, because the fact is people still don't know that they can get insurance.
It's so interesting. We're at a fair today that Dr. Clark and her team organized. I have to tell you, it's amazing how many people have come to sign up. And when I was talking, we had a panel discussion earlier, and I was asking about how they actually got people here today. It's a chilly day in late November, but they got people here. They got dozens of people who signed up. I'm curious, describe for our audience how you actually got people here to sign up. You had to actually go out into the neighborhood.
Yes, we have. The people who we serve, we have to go out and bring them in. And so we go onto the main street, we go into the stores, we go into the hair stores, we go into the salon, we go into the supermarkets. We go wherever people are to get them to come in here. It's tough, but the most important thing is that we've got to connect. We must connect to the people. So as we go out, we hand out our flyers, we tell them come to the health center, and we also carry laptops and iPads, because sometimes if we can catch them at the moment, we can register them to get insurance.
Who are the people who did not sign up the last time, and who are the people that you're really going after this time to try to get enrolled and have them have the health insurance they've never had before, or might have had and don't have anymore?
Yes, I find that most of the people we did not connect to are those that actually use technology because they have iPhones and they have all those games that they play at home, but they don't go on their computer to actually look for health-related entities or health-related things that they could use. So these are the people who are between 0 to 100% of the poverty guideline, and they are...
What does that mean? Translate that into non-federal government language.
Well, people who have no income, zero, or they are at 100% of the poverty guideline. You know, the federal government have these guidelines as to how poor you are based upon your income or no income. And there are people who fall within that gap with zero, no income at all, or they may be working, but they're working below minimum wage, because you have a lot of people who fall into that category, Steve. And so these are the people who, they have iPhones, they always do, but they don't know, or they don't use the media to find out about health insurance.
What would you say to those folks who say, hey, listen, it doesn't really affect me, I don't really need the insurance, I can go to the emergency room? You say?
I say that that's very costly, not only to the government, but to yourself. Because the most important thing, Steve, is this, that the people who we serve, who come here to enroll, they have diabetes, hypertension, everything that you can think about, they have them all in one. And so they need to take care of their health. You find that these are the people who wait until their blood pressure is going through the roof, or their sugar level is so high that they're dizzy. They're dizzy and can't even get up in the morning. You need to let them understand that they must have a connection with a primary care provider to make sure this does not happen. That is the penalty.
And finally, you're convinced the federal government has its act together better than they did the first time with this?
Yes, big difference this year. We're excited by the website. It works. We have
healthcare.gov?
Yes, healthcare.gov. There are less screens, and they also have it in different languages. So people can get on the website and they can maneuver. If you're using an iPhone, you can maneuver.
Thank you, Dr. Clark.
Thank you very much, Steve.
We're here with Carrie Lagoso-Mizarel, who is Director of Medicaid ACO, the Greater Newark Healthcare Coalition. By the way, your title, so that people could translate that, who may not know all the acronyms. Carrie, make sure we know what that means.
Sure. So the Greater Newark Healthcare Coalition is a regional health planning and advocacy organization, and a project of the Greater Newark Healthcare Coalition is the Medicaid Accountable Care Organization Initiative, which is looking to improve health outcomes for the Medicaid population.
What would you say is the most significant difference with the second enrollment period of so-called Obamacare, the Affordable Care Act, compared to the first?
I think two things come to mind. One is keeping the people who were enrolled last time engaged and making sure they understand their options for this year so they're making the best choices. And then we've learned a lot about the harder to reach populations, and so continuing to strategize to reach now those harder to reach, if you will.
Why are they so hard to reach?
One, I think it's, other than events like this and through media outlets like yours, New Jersey is in a tough spot because we don't have as broad of a media outlet as some other states, or a dedicated media outlet like some other states. And I think that our diverse population, we have such a high immigrant population and other cultural nuances that does make this a tricky program to break down and help people understand.
Language is a big issue, isn't it?
Language is a huge issue, and I think we have learned a lot the first time around about we need to do a much better job even with the Spanish language, and then there are so many other languages that we need to reach people with, Creole, other dialects that, so many, I wouldn't even be able to name them, but that's a challenge for New Jersey, and it's really an obligation that we have to reach our diverse population.
Talk about the challenge of public education and outreach.
Well, we're really relying a lot on volunteers, people on the street to get the word out, and then through not-for-profit groups who are already strapped with a lot of other service needs in their community. And now this is one more thing that we're asking them to do, largely because they have the trust and recognition of the people that they serve for other purposes, but it's another strain on organizations that are already stretched pretty thin.
So how would you describe the role of the media in all this in terms of public awareness and education?
I think the role of the media is crucial. It's just to the point that you made earlier during the panel. I think there's not a fiscal incentive we're not paying for commercial time to get this word out. So it's an interesting question.
No one's making money off it.
No one's making money off of it. So maybe it would be the health plans that maybe would be the ones advertising it.
Yeah, and again, by the way, Carrie mentioned an interesting point. There are more health plans engaged in New Jersey and really across the country, but for our purposes, we're primarily talking about New Jersey. The first enrollment period had a certain number of health plans in the marketplace, if you will, in the exchange. there are more this time around, which is better for consumers?
So yes, ultimately, because it's competition and there are more options for people, I would just, my reaction when I learned about the different plans, it can also be more confusing. I mean, one plan could have 18 different options for people. So it just underscores the need for a lot of education and communication with people so that they're making the right choice for them and their families.
Well, give some advice to people, because it's one thing to say, hey, there are more options, so you can shop for a better deal. On the surface, that makes sense, but give some advice to people as to how they can, in fact, shop for the best deal without being totally confused by the marketplace.
So I think there are some real key questions, like one, if you have a doctor, is your doctor part of the health insurance plan that you're considering? So you can check provider directory.
How can you find that out?
On the health plan websites, all have provider directories, or even like Cover NJ has resources on there.
Cover NJ.
CoverNJ.org is a website that's a statewide website that was ramped up specifically for the purpose of being a statewide resource for people so they can go to one spot. My other idea about going to the health plans, it just takes a little bit more work because you have to go to each one individually. But you would want to look at things like about your doctor. You'd also want to know what is your premium and is it affordable? So there are calculators that will help you with that. You want to know things like prescription coverage, because that medications, you want to understand if you're either on medication or one day will be, because now you're in healthcare.
How do you find that out?
So again, through the health plans, it would be prescription coverage is a part of their coverage specifics, and asking. I think talking to the person who's helping you with your application, and learning as much as you can before you make the decision as a consumer to purchase that health insurance.
And finally, your organization, describe again, the Greater Newark Healthcare Coalition. Coalition of whom?
So the Greater Newark Healthcare Coalition was started in 2008 as a CEO work group when two hospitals, St. James and Columbus, abruptly closed. And the CEOs of the other hospitals came together to preserve healthcare services and also to strategize and innovate so that people's health would improve in our region rather than get worse.
Thank you, Carrie.
You're welcome. Thank you, Steve.
Enroll America has been part of this effort to enroll people in the Affordable Care Act for a long time, and they're very much involved in this second enrollment period. And Alicia Teal, Deputy State Director in the state of New Jersey with Enroll America. Alicia, let me ask you, this second enrollment period is crucial from November 15th to February 15th, 2015. Talk about why it's so crucial.
This is a great opportunity for people to get health care coverage. Obviously, this is a life-changing event for many people who have never had coverage in the past. We want to make sure everyone who has in the past not been able to afford health care coverage knows that now there's financial assistance available. In New Jersey, 84% of New Jerseyans who've enrolled during the first enrollment period receive financial help. So this is just a great time for people to take advantage of this and access affordable quality coverage.
Alicia was part of a panel discussion we had here at the Greater Newark Healthcare, the Healthcare Coalition of Newark. And we're in East Orange right now, and you got people who are signing up, they're enrolling, there are people who are just hanging out here. It's a chilly day in November, but it's great. There are people who have come here. But during the panel discussion, Alicia talked about this help that is available, but you also, I'm interested because people were very surprised in the audience when you said there's financial assistance. Talk about that.
Right. So I think the great news is that financial subsidies are available. And what that means is if you make, depending on your household size and the amount of income for your household, there's financial help so that your premiums are more affordable. So in the past, premiums may have been closer to $450 on average in New Jersey. Now they're closer to about $148 on average. So it's more like a cable bill versus like half of a mortgage payment, which is just increasing, the amount of access people have to coverage that they can actually afford.
Significantly different from the first time around?
Well, what's different this go around is it's a shorter enrollment period. It's only 3 months, and we still have a lot of work to do. The great news is that we have 440,000 success stories of people who have actually been able to enroll and get the help they needed.
440,000 people in New Jersey got insurance the first time around under the Affordable Care Act in New Jersey, 8 million people across the nation. Those are success stories, right? So that should do what in terms of helping us the second time around?
speak volumes about the importance of getting covered and what that means. It provides people a sense of peace of mind and security that you can only have with healthcare coverage. When your child's sick and they need to see a doctor, you should have every opportunity to see a doctor and get the care you need. And we want to make sure that every New Jerseyan who's under and uninsured has access to health care and has the opportunity to enroll. And they can go to getcoveredamerica.org for more information.
Do that again?
Getcoveredamerica.org for more information. There's a locator tab you can put in your zip code, and it'll point you to events right in your local neighborhood and in-person help that's free. People who will help you enroll right on the spot, and so that you don't have to go through this process by yourself.
Lisa, talk about some of the challenges. There were challenges the first time around. Glitches on the website. People were frustrated. They couldn't get on the whole bit, right? They were confused. The second time around, while there's a great opportunity, there are also challenges, such as?
I think there's still the challenge that there's a lot of people that just don't have the right information. People don't know that when the enrollment period is. Enrollment for this period is November 15th through February 15th. People aren't aware that there's financial help available. That really just changes the scope of this for many people. If you can't afford shoes, you don't go shoe shopping. So if we're really making this within reach of people, we need to make sure that they know that
How about the penalties?
8 out of 10 New Jerseyans are receiving financial help. Yeah, and this year there's also the fine is.
I'm sorry, I cut you off.
Sure.
8 out of 10 what?
8 out of 10 New Jerseyans are receiving financial assistance with their health care premiums. And you're right, so there is a penalty or a fine this go round, and it's increased. So now it's $325 a person or 2% of your household income, whichever is higher. So that's also a motivating factor to make sure that people are aware of this so that they go out and take advantage of this opportunity to get health care. More
Carriers this time around, more options. Good thing?
Absolutely. I think there's, we know there's 2 new insurers on the marketplace in New Jersey, and there's, I think, a number of plans. I think in excess of maybe 30 additional plans. So there's more options for consumers. So that means they can better find a plan that fits their healthcare needs and their pocketbook.
This means a lot to you personally, doesn't it?
Absolutely. And I appreciate all the work that you've done and for really helping us to get the word out to New Jersey residents.
Now, on behalf of everyone at Public Broadcasting, we're all in. Thank you.
Thank you, Steve. We appreciate it.
We're here with Mr. Dennis Gonzalez, who is with the Federal Department of Health and Human Services. We're here in East Orange. Folks are signing up for Obamacare, if you will, the Affordable Care Act. Describe the role of your agency in all this.
Well, we are the primary federal agency responsible for implementing the Affordable Care Act. We have a special role in New Jersey because New Jersey is a federally facilitated marketplace. So we're totally responsible for New Jersey as opposed to New York, for example, which is state-based. New York runs their marketplace. We run the New Jersey marketplace. So we're very excited when we see events like this because it helps us do the job that we need to do to get people enrolled in the marketplace.
For those who say, hey, what's up with the healthcare.gov website this second time around with the second enrollment period from November 15, 2014 to February 15, 2015? What would you say? How's it working?
It's working great. So far, we started open enrollment on Saturday. So in less than a week, we've had over 1 million people enroll. Here in New Jersey alone, we've had several thousand people enroll. So we're very pleased with the way it's rolled out. Much better than last year. But what people don't realize is that the first 3 months of last year went terribly bad. But from January to March 31st, those last 3 months worked fairly well. And we were very pleased, especially with the numbers in New Jersey. We not only met our goal in New Jersey, we far exceeded it, both in the marketplace and Medicaid expansion.
What would you say to those, Mr. Gonzalez, who say, I missed the first enrollment period. I'm not convinced that I have to do it the second time. And, that penalty, I'm not worried about that financially. You say?
Well, the penalty gets higher. The first year, $95 and 1% of your income, whichever is higher. This time around, it's $325 or 2% of your income, whichever is higher. So if your income is in, $20,000 or $30,000, it could add up the penalty. So not only should people avoid the penalty this year, but the most important thing is that health insurance is very vital to have. It's something that everyone needs. And this is an opportunity to get health insurance that you otherwise may not be able to get.
And finally, for those who also argue that, they'll go to the emergency room, you say?
that is the most expensive way to get health care coverage. Not only is it expensive, but it's also very impractical because you have no relationship with the doctor. You're seeing this doctor for the first time, maybe never see him again. So we encourage everyone, unless it's a real emergency, stay away from the emergency rooms. That's why we have these federal clinics like here at Newark Community Health Center and other federally qualified health centers throughout the state. Just look for alternatives other than emergency rooms because it's just too expensive.
Thank you, Mr. Gonzalez.
Thank you.
We're here with a young man by the name of Lewinson, who is actually, you came here and you enrolled your mom, who's actually right behind you. Talk about that.
Well, I thought the process was going to be harder since I'm saying majority of trying to find Medicare and health insurance for people is complicated. But actually coming here today actually helped me noticing it's an easy process. All you have to do is come with the right paperwork and talk to the right people, and they will help you out as much as they can.
What did you tell your mom when you said, hey, we're going to this health fair, we're going to sign up for health insurance? I mean, is that all you said?
Well, I told her. She kept on worrying, saying, oh, I need to find health insurance and everything. I'm like, well, because the funny thing, we live right across the street from here.
We are at a community health center in East Orange. They've been here for a long time. You live right across the street, and how did you even know this was happening?
We saw, there was huge signs around here and everything, and I'm like, all right, might as well. They say health insurance, you can sign up here. I'm like, all right, let's see what we could do here. And then the worst thing they could tell us is, no, we can't help you out. They'll probably send us somewhere else. But they helped out. They're helping us out however they can right now.
Yeah, the Newark Community Health Centers, they're right here, and they've been doing a great job. Dr. Pamela Clark and her team here. And so you heard about it. You came here and describe the process, because I'm listening to your mom right now, who does not speak English, right?
Correct.
And so talk about the language part of it.
Well, the language part, they do also have people that speak different type of languages here. From what I know, they speak Spanish as well, but I didn't ask for it since I know English and Spanish, so I was pretty much translating for her the whole time. But they did ask if I wanted somebody else to translate for me, but I said, what's the point? I'm already here. Let me just help my mother out.
But what do you think it feels like for her to get health insurance?
I think it would be a great deal for her because, as you know, my mom she's going to that type of age that a lot of things will happen to her, God forbid. But then again, she want to make sure that she won't have to pay anything off, because in other words, she want to go to the hospital and then to have worried about a bill when she comes back home. That's pretty much, it scares her.
What's that do for you to know that she's going to be covered?
It's like a huge relief that I won't have to bear with the debt after that.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, Horizon Blue Cross Blue Shield of New Jersey, Bloomfield College, Wells Fargo, PSC&G, Holy Name Medical Center, and by Johnson & Johnson. Promotional support provided by NJ.com, Small News, Big News, True Jersey, and by Commerce Magazine. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
Did you know that the enrollment period under the Affordable Care Act ends February 15th? For those who are still uninsured, you may be eligible for financial support. But those who do not sign up for insurance must pay a fine of $325 or more. Every plan covers preventative care, doctor visits, and prescriptions. And with over 40 plans to choose from, you have every opportunity to get on the road to health.